Hello everyone, I am Dr. Jatin. I am MCH in DNB Urology and I am robotic, laparoscopic and endourology surgeon. My areas of interest are endourology, uro-oncology, renal transplantation. I am a consultant urologist at Apollo Spectra MRC Nagar, Chennai. Today I will be talking about stones in urology. By saying so, I mean those stones which are found in kidney, ureter, and bladder. We all know that stones are formed, but we all are curious how they are formed. Stones are nothing but they are the product of crystallization of a solute in any solution when it exceeds its saturation product. In the process, the environmental pH also affects a lot. In this process, the environment is provided by urine, and urinary pH affects a lot in the process of stone formation.
So, how common are they?
So, as per all the international studies, its prevalence stands around 12%, and it's exactly the same happens in India also. It's around 12% prevalence in India, and if you speak about stone belt, it's more common in northern part compared to south.
How do they impact us? Like, what are the common presentations?
Usually the presentation depends upon the stone burden and its location. If stones are present in the kidney, they usually present them as maybe an incidental finding. If it is present in ureter, they may present as a severe flank pain or blood in urine or difficulty in passing urine. If they are present in bladder, they poses symptoms like difficulty in passing urine, urinary retention or blood in urine. These are the most common presentations.
What comorbidities can affect the outcome?
The outcomes are mostly affected by comorbidities like diabetes mellitus, coronary artery disease, asthma, hypothyroidism or hyperthyroidism, and presence or absence of obesity. For diabetic patients specifically, the complications are a lot, as diabetes is a systemic disease which causes a kind of immunosuppressive state, and it also creates a situation in which body becomes more prone to infection. So in these cases, stone patients presents with their most common symptoms like pain along with the fever also.
What are the possible treatment options?
The possible treatment options again depends on the stone location and its burden. So if the stones are in the kidneys and they are smaller in size and they are causing pain, in those situations we have modalities which we can either leave them like that, or we can choose medicines or surgical treatment depending upon how bothersome symptoms are they to that patient. Like if a patient feels the symptoms are too much bothersome, in that case we can give them treatment in the form of medicines, symptomatic medicines, or if they are asking for surgical treatment, we can offer them shockwave therapy or RRS surgeries for kidney stones, or going for URS for ureteric stones, or going for cystolithotripsy or PCCL for bladder stones.
Does alternate medicine therapy is comparable in outcome?
Yes, so this is a very important question, and I would like to answer it because many patients come which are having history of stone disease, and they are keeping the stone for long duration, and they're thinking that their alternate medicine therapy will probably dissolve the stone and they will become free over time. I would like to clear this doubt that alternate medicine is nothing but it is delaying the definitive treatment. I am not doubting the modalities, but as of now, what my personal experience says that use of alternate medicine therapy is more for prevention than for cure.
So, among the conservative treatments or therapies, do we have any modalities which can dissolve the stones?
This is another very frequently asked question, and I would like to clear this doubt that mostly the medicines which we give to patients, they are for expulsion of stone and not to dissolve the stone. We don't have medicines which literally dissolve any stone. Usually we give them expulsive therapy in the form of alpha blockers, and they cause a little bit of dilatation of the tract and helps in the expulsion of the small stones across the tract.
Now, does dietary restrictions do any benefit?
Yes, dietary restrictions do make much of benefits, but not when a patient presents in the acute stage. Dietary restrictions do the prevention of the stone formation and not the treatment.
How to know or decide that now we need to switch modalities for treatment?
Yes, so usually it's the patient who understands his body better than anyone. Whenever a patient experiences or presents with their chief complaints, they are mostly bothered about that complaint alone. So we start the treatment depending upon the bothersomeness. We will start first with the medicines. Once medicines are not working, then we ask them and we give them options whether they want to wait or they want to get operated. If patient tells or prefers to undergo surgery, in that case we tell them the options. Or sometimes if the patient develops complications in the form of persistent fever, persistent pain, derangement of the kidney function test, then we have to actively tell them that now your treatment line is insufficient and it needs surgery.
Now, what are the surgical modalities?
So again, depending upon the location and stone burden, we have surgical modalities which are divided in endourology. For kidney areas, we have surgeries like ESWL, RIRS, PCNL. These are again done based on the stone burden. If stone burden is less, then we prefer to do RIRS or ESWL as preferred by the patient.
What are the surgical modalities?
So depending upon the stone burden and its location, we have modalities like PCNL, RIRS, ESWL, then URSL, cystolithotripsy, PCCL. For kidney stones, if stone burden is less, stone size is small, we offer ESWL or RIRS as chosen by the patient. And if stone burden is more or any complicated anatomy is there or history of past surgery is there, in those cases we prefer to do PCNL. For ureteric stones, we prefer to do URS. And for bladder stones, we prefer to do cystolithotripsy or PCCL, depending upon the stone burden again.
Does a stone in the body which doesn't cause any symptom need immediate treatment or can we delay it?
So again, as I've said, that many patients, they come to us with a faith that their stone will get dissolved over time with the use of the alternate medicine therapies or the dietary restrictions which they are following. These patients, they finally land up in complications. What complications I mean is like in the form of reduced renal function, increased creatinine levels, and further complications. So I would suggest that even though stone is asymptomatic, but if its burden is high, it's always better to go for surgery or any treatment modality which is suitable according to its burden.
What is ESWL or shockwave therapy? Is it better than the other modalities?
Yes, so many patients prefer this shockwave therapy. For smaller stones inside the kidney, it is good, and its outcomes are good. But again, its outcomes are dependent moreover on the anatomy of the kidney. Sometimes kidney anatomy doesn't allow the fragment to come out, and in those anatomies, ESWL doesn't stand good. And one example for such anatomies is calyceal diverticulum, narrow infundibulum, long infundibulum, large and acute angles between the pelvis and ureter. Those are such conditions in which fragments which are produced after shock wave therapy doesn't come out and they stays inside the kidney and later on convert into bigger stones. So I would suggest that not in every case, but yeah, small burden and single stone is there with a favorable anatomy, ESW is definitively favorable.
What is keyhole surgery and is it the same as PCNL?
Yeah, so many patients in different part of country name PCNL as keyhole surgery. It's nothing but a small skin incision is given under the image guidance and sheath is placed, microscope is inserted, and then calculus is fragmented by using different modalities like laser, pneumatic lithotripter, etc. So yes, PCNL and keyhole surgeries are same.
What is URSL or RIRS?
URSL means ureterorhinoscopic lithotripsy and RIRS means retrograde intrarenal surgery. Mostly their name itself explains what they are. Ureterorhinoscopic lithotripsy means use of a semi-rigid ureteroscope to perform surgeries in the distal and middle part of the ureter. For proximal ureters also we can reach by semi-rigid ureteroscope, but those which are near to the pelvis or above the level of the kidneys, those ureteric calculus are better dealt with flexible scopes. Flexible scopes means those scopes which can work even inside the kidneys at different angles, and those scopes whenever used, and those surgeries are labeled as RIRS because in these surgeries we push these scopes inside the kidneys and we break the stone there itself using laser.
Is stent needed every time or can we avoid it?
Yes, so many patients they come and they ask actively about the stent. They have a taboo or some misconceptions that stents they always cause discomfort, they always cause bleeding, they always cause symptoms. But I would like to tell that it's not every time that they cause all these threats, and the complications which comes are also treatable by giving appropriate medications. So what I suggest is it's all depends on the intraoperative status whether stent is needed or not. If inflammation is too much or intraoperative obstruction of the stone is very high, it's always safe to put a stent because that stent will facilitate the healing. Another thing is if you are doing RIRS or PCNL, in those modalities stents always are beneficial because if there is any stone load which is left, stone fragment which is left, that will come, and at the same time if any small clots are there, those also comes along the stent surface. So it's always beneficial to put the stent, and it's basically it's actually a decision which is taken intraoperatively depending upon the kind like the situation. So it's a decision which is totally dependent on the doctor who is operating.
Can the patient go home on the same day after the surgery?
So nowadays most of the surgeries are done as a daycare basis only, and these are the surgeries which have a favorable outcome whenever they are performed on a daycare basis. So it all depends what modality of the anesthesia is chosen, and if at all patient is having comorbidities or not. If a patient is having multiple comorbidities and he has underwent GA, then those cases we will retain a patient for a day or so. But most of the cases can be discharged in the day as a daycare procedure itself.
What are the expected outcomes?
So in the hands of experienced surgeons, most of these surgeries they they give us best outcomes and almost 100% clearance rate. But yes, it all again depends that who is doing the surgery, how much is the stone burden, how is the anatomy. Sometimes it's tough to operate and remove all the stones. In those cases, we do stage surgeries. We complete as much as possible and we leave it for second time after putting stents.
Are there any complications?
Yes, there are some complications are there. As with all the surgeries, they also come up with complications like intraoperatively, based on what energy we are using, we have to expect the outcomes in the form of, like, if you are using laser at higher settings, that poses a risk of ureteric stricture. Sometimes when tight ureter is there and the scope is in hands of a new surgeon, he may go and injure the ureter, leading to avulsion. Sometimes there is bleeding, persistent bleeding in post-op period. So they are the most common outcomes. Beside that, there may be mild burning sensation of urine due to the passage of stones. There may be mild urinary discomfort, mild bleeding. So these are the ones which are most common ones, and yes, they are the and they all are treatable. So mostly, yes, complications are there, but they all are treatable, reversible complications.
Is there any risk of recurrence?
Yes, so all the stone formers, they have a tendency of stone formation because of some internal underlying genetic factor or their dietary restrictions. So in their cases, mostly if they have formed stones, they always have a 50% risk of developing stones again in the future.
That's all the questions we have for today. So thank you, sir.
Okay, thanks a lot.